Good evening, everyone. Sorry for the late upload. Been on vacation this week and haven't been really near a computer. But needless to say, in today's lecture, we're going to be covering Chapter 19 from our Microbiology for Health Sciences textbook. And in this chapter, we are going to be covering the infectious diseases manifesting on the skin and inside of our eyes. Let's begin. The first thing we're going to talk about is our skin and its defenses. Now, there are many different diseases or many infections can happen on the skin, and these include eruptions or lesions as part of their course of illness, and they're often a major symptom, even though they are not primarily the infectious diseases. The skin is part of the in, integumentary system, and this includes as I said, the skin, and includes the hair, the nails, sweat glands, and the oil glands of our body. The skin has a surface area of between 1.5 to 2 square meters, and its thickness varies from 1.5 millimeter at places such as the eyelids to 4 millimeters at the soles of the feet. The dermis is the layer that's underneath the epidermis, and it is composed of connective tissue instead of epithelium like it is in our epidermis. The dermis is a matrix of fibroblast cells and fibers such as collagen, and it contains macrophages and mast cells. Next, we're going to discuss the biota of our skin, and the skin is inhospitable to the growth of many types of different microorganisms, and the vast dry and salty surfaces, many of which are coated in toxic antimicrobial liquids, were once thought to be sparsely covered in different types of biota. There are many generalizations about the skin's biota, such as hundreds of species of microbes are distributed over many areas. There are five major taxa represented in the microbiota, which includes the predominance of groups varied in different regions of the body. There are large differences among people with respect to the types of microbiota, and an individual's own skin microbiota is relatively stable over time. The majority of microbes reside in the uppermost layer of the epidermis, and nearly 25% of all bacteria that is in the epidermis are localized on our hair follicles. Now, down here, we have a little graph of the skin, the defenses that it has, and the type of normal biota that it contains. If you want to pause and just take a look at it here, and we will move on now. Our first um, type of disease we're going to cover is MRSA, and this is a type of it is a common cause of skin lesions in non-hospitalized patients, and the infections tend to show signs of inflammation. So this would be redness to the skin, raised above the normal skin, tender, localized lesions, and it often features pus and is hot to feeling to the touch. It is common on all surfaces of that we touch daily. So this would be things like gym equipment, airplane tables, electronic devices, our razors, and things such as that. Um, Patients with MRSA should always keep their lesions covered at all times, and this prevents from this infection being transmitted to others. And by keeping these covered, you are saving a lot of different types of skin conditions as well. Our next one we're going to cover is impetigo. I apologize if I'm mispronouncing this one. And this is a highly superficial bacteria infection, and it causes our skin to flake off. It is not a serious disease, but it is highly contagious, and children are the primary victims of it. It can be caused by numerous bacteria, such as um, S. pyogenes, S. aureus, and they are both highly contagious as well. And they're transmitted through direct contact, through, but and also through fomites and mechanical vectors. This is diagnosed through visual examination, and it is treated with antibiotics. And these antibiotics target the bacteria that we discussed just a few seconds ago. And the best prevention of this infection is a just keeping good hygiene is all you need to do. Now we're going to discuss. Oh, well, we'll move back here. Here we have a picture to the right here, and this is a what impetigo looks like on the shoulder. It's from figure 16.9 of our textbook. And this was also a picture of it on our last slide as well, right here from figure 619.3. Now we will discuss cellulitis. Cellulitis is a condition, and it's caused by fast spreading infections in the dermis and the subcutaneous tissues of our skin. It causes pain, tenderness, swelling, and warmth to the touch of our skin. Um, it also causes fevers and your lymph nodes to swell, and it also causes your lymph nodes to drain and secrete. Um, Most cases are uncomplicated and do not involve hospitalization. So patients usually have a good prognosis with this type of infection. Now to the right here, we have a little graph on it's a disease table from our textbook, and it shows the names of the diseases and just so forth, and what the causes are, the treatments, and how you prevent this disease. Next, we're going to discuss the eye. Now, the eye's defense it has defenses and a normal biota, and the eye is a very complex organ, and it is made up of many different types of tissues, but we won't discuss these tissues today. Those will be discussed later. But the eyes contain a conjunctiva and a cornea. Now, the conjunctiva is the thin fluid secreting tissue that covers the eye and lines the eyelids. So is involved in the creation of things such as our tears and helps keep our eye moisturized. The cornea is the transparent dome-shaped tissue, and it covers the iris, the pupil, and the anterior chamber of our eye, and is composed of 5 to 6 layers of epithelial cells, and these regenerate quickly. Inflammation does not occur as readily in the eye, um, as it does in other body parts, and corneobacterium is the most common and the most dominant genius in the eye. And to a very large extent, the microbiome of the eye really resembles the microbiome of the skin in the types of microbes that it holds and carries and can carry in itself. And then here we will move on. Now, next, we are getting into these last two slides. And oh, well, 1 second here. We'll go back and look at I forgot about our graph. Here to the right, here is figure 19.18 from our book. And this just gives you a brief anatomy of the human eye. So as you can see, here's the cornea and the lens that surrounds it. If you want to pause here, you can look and study this part, but I'm not going to personally cover it at the moment. Now, these last two slides, we're going to be getting into the diseases and infections of the eye. And the first one we're going to get to is conjunctivitis. And this is the infection of the conjunctiva is a relatively common infection, and it's caused by microbes that have a preference for eye tissues, and they're contaminants that are introduced by the presence of, let's say, like a contact lens, or you have a traumatic injury to the eye, or um, by accidental incolation of the eye by a traumatic event as well. Um, that has symptoms that are similar to pink eye. So it has secretions, redness, eye swelling, and you'll get things such as itching in this as well. And the secretions pus-like fluids. And for those who've had it, if you fall asleep with this, it can seal your eye shut in your sleep, and you have to wake up and pull your eye apart, which can be extremely uncomfortable. Um, and this can be common in children as well. More on the infant side of children, and the only way to prevent this in children and adults other than neonates is good hygiene as well. So just keeping the area around your eyes clean and washing your hands before you touch your eyes and put your contacts in and so forth. Now, right here to the right, this is from figure 19.20 in our book, and this is a picture of neonatal conjunctivitis. And this, as you can tell, it occurred in an infant, and it looks like it has sealed its eye shut from the secretions, and the doctor or the parent is trying to pull their eye apart so they can open their eye. It can be extremely uncomfortable to infants and so forth. Now we're on our last slide, and this is keratitis. Now, keratitis is a more serious infection than conjunctivitis. This infection invades is an invasion of the deeper eye tissue, and it can lead to complete destruction of the cornea. Um, any microorganisms can cause this condition, especially after trauma to the eye. So let's say eye damage to the eye from maybe a sport, getting hit in the face with a ball or something of that nature. A common type of keratitis is herpetic keratitis, or HSV1. And this type of infection, it's once reactivated, it travels into the I'm sorry if I mispronounced this, but opth ophthalmic, rather than through the mandibular branch of one of the nerves in the face, and this can be very painful in the eye and cause a lot of discomfort as well. Um, the treatment for this infection is topical trifluridine, and it is sometimes supplemented with an oral medication as well. Right here to the right here is another one of our disease tables, and if you want to take the time to pause this now, it includes in a little more detail on the treatment plans, the features, and the cultural diagnosis and the violence factors and so forth. But as of now, we have completed chapter 19. I hope you all have a great week this coming week. Again, I'm sorry for getting this lecture out late as I have been out of town this week. Thank you all for listening, and I hope you have a great evening.